Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Each. So today we will discuss another lecture in the series Anesthesiology. I know I am posting this video very late. I was really busy in my workplace, but I will try my best. From now on video will come regularly. I know I am not keeping my promise of keeping videos regularly, but I will try my best. So today we will discuss the lecture pain pathways. Okay, before going to the lecture, please subscribe to this channel. Before that, this is my Facebook channel where I post many of the case reports. All the case reports I can't post in YouTube because of insufficient data, but I post those pictures in Vet Surgery at Ease in Facebook, and this is a page in Instagram, Vet Essentials, in which I post different notes which I have collected during my undergraduate career, and you can see I have already posted all the notes. Okay, but I will keep posting more notes if I will get any notes. Next, this is my Twitter handle, you can follow it there, but please subscribe to this YouTube channel. There will be a subscribe button. Now coming to our lecture, the pain pathways. So first of all, the pain receptors are known as nociceptors. I have already told you in the introduction class. Okay, pain pathways. The pain receptors are known as nociceptors. They are basically naked nerve endings and they are found in skin, which is basically the superficial pain, or also in deep tissues, which is basically deep pain, or you can say visceral pain. And you should know that there are two types of fibers, the fast conducting A delta fibers and slow conducting C fibers. Okay, the fast conducting fibers are basically responsible for sharp and pricking pain, while the slow conducting C fibers are responsible for slow and burning pains. Okay, now you should know the ratio of A delta to C fibers. Okay, in somatic structures like skin, you will find the ratio 1:2, and the visceral structure you will find the ratio 1:10. It means there are more slow conducting fibers in visceral structure rather than in somatic structure. Okay, another concept or another thing you should know about the silent nociceptor. What are the silent nociceptors? It means usually these silent nociceptors are high threshold. Okay, high threshold for pain. But when there will be inflammation or there will be inflammatory mediator circulating inside the body, this threshold reduces. You can test how silent nociceptor works. Okay, for boys they can do it. Okay, find a girl who has a big brother and who goes to gym. Okay, go to her and propose her in front of her brother, and her brother will give you a nice blessings. Okay, on the day of blessing you will feel less pain, while in the next day you will feel more pain. Why? Because of this activation of silent nociceptors. Okay, on the day of blessing there will be starting of inflammation, and when the inflammatory mediators will reach your blood circulation, these silent nociceptors will get activated, and the phenomena is known as primary hyperanalgesia. Okay, primary hyperanalgesia. Okay, just after inflammation the pain, the sensation of pain increases. Primary hyperalgesia. Analgesia is absence of pain. I am sorry, hyperalgesia. Next, you should know some concepts. Okay, before going to the pathways, you see there are three structures in brain. You don't need to go into very detail. Just remember the names: the reticular formation, hypothalamus, and the limbic system. What is reticular formation? It is present just near the thalamus, and it regulates the heart rate, respiration rate, and also it is responsible for giving your attention to the stimulus, and it is responsible for consciousness and the cortical alertness, the mental alertness. Next, we know about hypothalamus. They are basically responsible for physiological or emotional response towards pain, and they regulate the epinephrine or norepinephrine and also glucocorticoid concentration in the bloodstream. Next, the limbic system. They activate this limbic system. They are basically responsible behavioral, means you will take your hand away from the fire, or if a nail gets bitten, you accidentally the nail is punctured on your foot, then you will take your foot away. This is behavioral. Cognitive means it will remember the type of pain. Next time you want you will be very careful while stepping on a nail. Okay, so you should know these three structures. Next we will go to the pain pathways. There are basically three pain pathways. First one is the Spino-Cervical-Thalamic tract. Okay, we will not go so much in detail, only the how it works. Okay, it is responsible for superficial pain. This is a primary conscious pain pathway for carnivores. Remember this one, it may come as an objective question. What happens? So this is here the pain will be perceived. It will travel through the primary afferent neuron, and there will be formation of they will synapse with a secondary neuron. This is secondary neuron inside the dorsal horn of this is spinal cord, and they will travel in the ipsilateral tract. Ipsilateral means if the pain is perceived in left hand side, then they will travel in the left side. If it has traveled in this side, this would have been be contralateral. Okay, but they don't travel in contralateral tract, they travel in ipsilateral tract. Okay, so after the traveling through the spinal cord, they usually travel through lateral funiculars. This white matter part is known as funiculars. Okay, so they will travel through lateral funiculars, and they will form the they will go to the lateral cervical nucleus, the LCN. Okay, lateral cervical nucleus. You see from the name itself, Spino-Cervical-Thalamic. Here it migrate the pain sensation went through the spinal cord, then the cervical nucleus, then they will go to the thalamic relay nucleus. From the thalamus, from there they will go to the somatosensory cortex. But some fibers, they will end up in the reticular formation. I already told you reticular formation. This is present just near the thalamus. Some fiber will go to the reticular formation. Next we will go to the second pathway, that is Spino-Reticular Tract. This is for deep pain, or you can say visceral pain. Here remember the difference. Here it's the same. The primary neuron will synapse with the dorsal horn in the spinal cord, but after synapsing they will give branches. Okay, so you can say in Spino-Cervical and thalamic tract, the pain travels through the ipsilateral tract, where in this case they travel in both or bilateral. You can say they will travel in bilateral tract. Usually they travel in lateral and ventral. There you saw the lateral funiculus. This lateral funiculus, okay, ventral funiculus, dorsal funiculus. Okay, the spinal cord is in upside down. So they will travel in the bilateral tract, and most of the fibers they will end up in the reticular formation. Some they will go to the diencephalon, means the brain. Okay, but most of them will end up in reticular formation. You see in the Spino-Cervical-Thalamic tract, the end point is actually thalamus. Then after they will go somatosensory cortex, that is brain, inside the brain. But here in this, the visceral pains usually sensed at reticular formation, RF. Okay, so this is the difference between the Spino-Cervical and thalamic tract and the Spino-Reticular tract. Next, third one, this is a special type of tract. This is usually for the nociception of head region, only for the head region. Okay, so what happens here? The nerve fibers or the pain sensing nerve fibers, they will come to the trigeminal ganglion. This is trigeminal ganglion. Then after they will go to a neural column. This is a neural column. This structure is a neural column. This resides just outside the spinal cord. This is not a part of spinal cord. This resides outside the spinal cord, and they have the three parts. You see, first, second, and third. First one is mesencephalic nucleus. This one is pontine sensory nucleus, and this is spinal nucleus, or you can say spinal nucleus of V. Among them, only the spinal nucleus is of our importance, which is basically for the nociception. Like in pontine, you will find proprioreception, and tactile reception. Okay, they have different functions, but our main concern is the spinal nucleus, which is for the nociception or for the pain reception. From here they will go to the reticular formation. Okay, so these are three systems. Okay, first one is the Spino-Cervical-Thalamic Tract, in which the pain will be sensed in the spinal cord, then from there lateral cervical nucleus, then from the thalamus, then from the brain or somatosensory cortex. But here pain will be sensed, then the spinal cord, spino, then reticular formation directly, no cervical nucleus, and there they have ipsilateral, from left side will travel through left one, then here, but they are bilateral, okay, they will travel in both sides. This is trigeminal only for head region, in which they will travel through the spinal nucleus of V or the neural column, okay. So these are basically three pain pathways, and remember for testing, for this one, if you want to test whether this tract is intact or not, you can simply pinch the skin, not like you are severely pinching, light pinching, or you can apply a hemostat, like lightly you can apply a hemostat on the skin. If the animal responses, then you can say the Spino-Cervical-Thalamic tract is intact. For this one, for the Spinoreticular tract, you have to apply the hemostat at the base of toenail, okay. If the animal responds, then you can say the Spinoreticular tract is intact, okay. These two are set testing methods for these two main tracts. Trigeminal is only for head region, okay, but these two are for rest of the body. So this is all about the pain pathways, okay. Next class we will go for the analgesics, okay. I will try my best to keep the videos in a regular time, okay. So you can subscribe to this channel, please do subscribe, and we will meet in the next class. Thank you, bye bye.